It's time to talk. So it's almost exam time, and you're starting to feel a little anxious, aren't you? Are you starting to doubt yourself? Well, don't you dare do that, because various tutorials got you. In today's episode, we'll be looking at past paper questions, and I'll be providing you with a study guide. Stay tuned. Okay, guys, so we're looking at CSEC past paper questions, exam year from 2019 going back to 2018 and 2017, right? And what we'll be focusing on is all the question ones from these years. Now, the reason why we're focusing on, say, question one for these years in this episode is that I want you to get an idea of what a question one looks like, right? And so far, you will see that question one is basically based on section one of the syllabus, right? Now, these questions are similar. At some point in time, we may have like a few repeat, but for us to study the pattern and to be comfortable and to have an idea to predict what your coming question one for 2021 will look like. Remember, we didn't have any paper two for 2020. This is how I have decided to go about it. All right, so now let's get started. So we're starting with 2019. All right, and the question one for 2019 reads, number one, define the term nutritional status. State 4 types of assessment that are generally used to evaluate nutritional status. Suggest 3 reasons why the effective management of diabetes mellitus is costly. And finally, outline 2 reasons why pregnant women are required to have an increased intake of iron in the diet. All right, now I know you should be able to answer these questions, right? You must be saying cheese, aren't you? All right, let us look at the ideal responses. Now, as it relates to the definition for nutritional status or status, you may have nutritional status refers to the state of the body resulting from the intake and use of nutrients, right? Now, that's the simple definition, but remember we're going for 2 marks, so it would be nice if you include the nutritional status of an individual is influenced by the quantity and quality of food intake and the person's physical health, right? So the amount of food taken in, the quality of that food eaten, what type of nutrients are found in those foods, are those foods empty calories, and the state of the person's body, are they physically active? So based on those 3 factors, very important, that will lead us to having a good or a bad nutritional status, right? All right, next question. Oh, sorry, I skipped a bit too fast. State 4 types of assessment that are generally used to evaluate nutritional status. Now, you notice that the verb says state, right? So you couldn't just go and write anthropometric measurements, biochemical, clinical, and dietary. No, ma'am, no, sir, right? So state meaning that we have to identify the nutritional assessment methods and also to write a brief description of each, right? And even though we use the acronym, the A, B, C, and D of nutritional assessment, we don't go and write that there either, because you won't get your, you won't maximize your points, right? So the ideal responses are anthropometric measurements, which involves measuring weight and height of infants and children. The objective of this method is to ascertain the health history and health status of a child. The next one is biochemical assessment, or we may say laboratory test in brackets. is based on testing body fluids such as blood and urine, as they are indicators of nutritional status. Next is clinical, sometimes called physical. So the clinical data, what it does is to provide information about the individual's medical history. So it's like when you go to school, before you're admitted, you have to do a medical, right, to school, right? So that is an example of a clinical. And then if they ask you to do a urine test, then that's a biochemical. If they go and test your weight and your height, that would be anthropometric. Good. So clinical assessment, as I said before, provides information about the individual's medical history, including acute and chronic illnesses and diagnostic procedures, therapies, or treatments that may increase nutrient needs or reduce malabsorption. Good. So malabsorption refers to when we consume the nutrients, but our body is not able to absorb those nutrients. And the final assessment is dietary assessment, and it is a comprehensive evaluation of a person's food intake, right? And examples of dietary assessment may be your 24-hour recall, so what you eat within a day, or your diet history, which may span over a month to several months, right? So if the question had asked to list 4 types of assessments that are generally used to evaluate nutritional status, you could have written just anthropometric measurements, biochemical assessments, clinical data, and also dietary assessment. But because it asks you to state, you have to write a brief description of that particular assessment, right? So a question may say for you to list the 4 the A, B, C, and D's of nutritional assessment. You know, they're talking about these 4. It may ask you to just list the nutritional methods of assessment. You know, it's the same thing, that same responses that they are looking for. All right, our next question. Suggest 3 reasons why the effective management of diabetes mellitus is costly. All right, so what I have here are 3 pointers that you could look at, right? I believe this question was about 6 marks. All right, so we're looking at why diabetes mellitus is costly. They could also ask us why another lifestyle disease is costly, whether it be hypertension or cardiovascular disease, right? So depending on the lifestyle disease that they may ask, then you know that certain things are unique, right? Certain key terms are unique. Good. So, but if a different lifestyle disease come instead of diabetes mellitus, you know the responses would be similar, if not the same, right? So the first point we're looking at is government expenditure on health bills. The government will have to spend more money to produce inpatient and outpatient care at outpatient care, as well as hospital supplies. So we may speak of beds, medical tools or apparatus, also funding for national health cards for discount on medications. All right, so take for instance, in Jamaica, you know that healthcare is free. Good. As well as other parts of the country, right? Other parts of the world or other countries. Good. Now, government will have to spend more money on, because if more persons get sick, they have to consider bed space. They may also have to spend money on procuring or funding national health cards, such as the NHF. Good. Also, disposable income spent on health. We could look at families who have members that are affected by diabetes mellitus or any other illnesses will have to budget and spend money on health bills. So the disposable income is the amount of money that they get to take home after taxes. And guess what? That money that they get to take home after taxes, money has to be budgeted for medication, insulin medication or tablets, and also special dietary requirements. Because if someone is diabetic, they have to make adjustments to their diet, what they consume on a daily basis, and those adjustments may be a little bit expensive for more to consume more fibers, so more fruits and vegetables, right, and more food that are whole wheat foods that are high in fiber, and also the class of protein may be a little expensive, and also for their doctor visits as well. All right, now the next point we're looking at is human resource capacity. Human resource capacity is about ensuring that an organization has enough people with the necessary skill set to achieve its objectives, right? So if the workers are becoming sick, say for example in the hospitals, if they too are victims or patients who may have lifestyle diseases such as diabetes mellitus, as this question asks, then there will be shortage of workers. And guess what will happen? When the worker is short, the more persons will have to work overtime, and overtime is more money that is calculated than if you are on staggered shift, right? All right, so you have to develop your discussion based on those pointers. All right. Our next question, outline 2 reasons why pregnant women are required to have an increased intake of iron in the diet. Now, this question is basically asking what is the function of protein, right? Sorry, what is the functions of iron, right? And in thinking of the functions of iron, we also have to consider the person who they're asking why these persons need iron. So we're thinking about the pregnant women, and we're thinking about the state of their bodies, right? So they are, we may say they're catering for a developing baby. All right, so now let us look, knowing what the risk of not having enough iron are. We're now, remember where we look at anemia when we were looking at lifestyle diseases. Now let us look at some ideal responses, right? So they are at a higher risk for iron deficiency anemia because their bodies are catering for another human being and will require adequate blood supply for development. Also, pregnant women may lose excess blood during childbirth, and this can cause them to become unconscious or to develop other complications which are can be detrimental, right? Now, babies can be born, babies can be born prematurely and also have a low birth weight. Now, having anemia may also lead to tired feeling in the pregnant woman, and guess what? During childbirth, they will need the energy, right, to give birth to the baby. So that is also detrimental. And also, iron also helps to move oxygen from the lungs of the pregnant woman to the rest of the bodies and also their babies as well. So these are all the reasons. The question asked for 2. I gave you about, how many is that? I gave you about 5, right? So you can choose the ones that you're comfortable with. All right, and that was it for the 2019 questions. And just to be clear, they may not ask you for pregnant women, but they may ask you for convalescents. They may ask you for adolescents, especially like teenagers or women of childbearing age. So remember, you have to, and they may not ask you for iron. They may ask you for proteins. They may ask you for carbohydrates, right? They may ask you for some minerals. Now, whatever nutrient that you get, remember that you have to think about the functions of the nutrient and what will happen to the body of those persons who don't consume those particular nutrients. For example, adolescents, they may ask you why adolescents, it is important for them to consume, for example, say calcium, right? So we know that most of the the bones, right, the massive growth during the adolescence years, then will need the calcium so that the bones can develop properly. All right, the main function of protein is to build and repair. So persons who are say the toddlers, Why do they need protein? Why do they need calcium? So think of the stage of the individual, the convalescence, those persons who are recovering from illness or injury. So think of the state of the person and also the function of the nutrients, and you should be able to answer these questions accurately. All right, guys, now let us look at 2018. So that was 2019, question 1. Now we're moving on to 2018, and let us look at the questions that were under question 1. So you notice that it's a combination question, right? So number 1, A, list 3 organizations involved in community nutrition in the Caribbean. 3 marks. B, explain 2 roles of community nutrition in the Caribbean. 4 marks. Discuss 2 factors that contribute to changes in the dietary requirements of individuals, and your discussion must include 2 examples of each factor. D, identify 2 types of high intensity activity suitable for adolescents, which may assist them in maintaining optimum health. And the final one was state the minimum length of time the activities identified above should be carried out for it to be effective. Now, all right, let us look at the ideal responses. Now, as it relates to list 3 organizations involved in community nutrition, you also know that we have national organization, right? So it may be, for example, in some countries, it's Ministry of Health would be like a national organization, but they more than likely gonna ask you for regional and international organizations, right? And you can choose any 3 from the ones here. We have World Food Program, we have World Health Organization, we have Food and Drug Organization, United Nations Children Fund, United Nations Development Program, Pan American Health Organization, Canadian Public Health Association, and also the Caribbean Food and Nutrition Institute. Now, very important, guys. So for example, you're going to write World Health Organization, and you just write down the acronym WHO. Say you write WHO, you write FAD, you write PAHO, PAHO, the acronyms. You are not going to get your full marks. So please write out the acronyms, write out the meaning, the full meaning for these organizations, write their full names, and if you want to put the acronyms, the abbreviations in brackets, you can. But ensure that you write the full name for these organizations so that you can get your marks, all right? Okay, let us move on to the next question. Explain 2 roles of community nutrition in the Caribbean. Now, community nutrition supports communities to address child malnutrition prevention, screening of children, and also referral in cases that are discovered, and provide treatment to community members. So that is just one role. They also helps to promote good health, good hygiene practices, and positive nutrition behaviors. They promote the dietary guidelines of the Caribbean, right? Is that in a determined effort to prevent diseases, and also community nutrition provides education to community members to provide nutrition and diet counseling for vulnerable groups within the community. You see how many importance I gave you guys? How many roles? So if the question says to state the importance of community nutrition, now you know the roles and the importance can be interchangeably. So why is it important? It is important because they try to prevent malnutrition of the community members, and also to promote what? Good health and hygiene. And I know you can get many more from this response that we have here. Next question. Discuss 2 factors that contribute to changes in dietary requirements of individuals. Your discussion must include 2 examples for each factor. So when we're discussing the factors, I want to point out something to you. We're not speaking of food choice. Remember, when we speak of food choice, these are the things that the factors that allow a person to choose what you want to eat, right? So if you see an advertisement and then something looks so appealing to you and you want to go and have it, that's an example of food choice, right? So don't mix this question up. This question is asking you for factors that contribute to change in dietary requirements. The key term there, dietary requirements, is very important. So what is it that you must have in order for you to meet based on the state of your body, right? And the first factor we're discussing, we're giving an example here. We have some examples. So we have age, we have gender, we have level of activity, occupation, state of health, and also physical special needs. Now let us look at an example of how we could discuss. So it says that we're supposed to discuss the factor and also to give examples. So let us look at age. Now, aging is linked to changes that can make you prone to deficiencies in calcium, vitamin D, vitamin B12, iron, magnesium, and several other important nutrients, right? From the newborn to the elderly, all age groups have special dietary requirements that, if not taken into consideration, can make them prone to diseases, right? So here's the example. Toddlers and young children needs calcium to aid in the formation of their developing teeth and bones. Another example, if you're discussing, say you want to discuss gender. So we're looking at male and female, right? So right off the bat there, you know that the female will require some vitamins and minerals that are very essential, that are not necessary. They're important to the male, but more so very important to the female. For example, iron. So women, especially during menstruation, that they have to replace the iron and also have things like vitamin C in order for the iron to be absorbed, right? Now, think of those things. Even like for males, that they will require more. Their body is generally bigger, and thus they may do more manual work at times, and thus based on occupation coming out there as well, their needs may also change, right? All right, if we're looking at level of activity, let's think about an athlete. Look at all the energizing activity that they have to do versus someone with a sedentary lifestyle. So someone who is not really active, for example, maybe like a office worker, right? An occupation, let's think of a construction worker versus a teacher. State of health, if the person is anemic, if the person is diabetic, if the person has hypertension, this person will have to lower their intake of sodium, right? And try to consume more low-fat meals and also those diets that contribute to good health and well-being. So we speak of the high-fiber diet, the vegetarian diet, low salt, sugar, and fat diets, all right? And we may also think about special needs. So we may speak of pregnancy and lactation, as the pregnant women are catering for the growing baby and also for themselves and have to prepare for breastfeeding and lactation as well, right? Remember that question where we looked at previously on the 2019 paper that asks why iron is important? So some of those stuff, you can discuss some of those under here. Now, for persons who are convalescent, you describe who are convalescent. So these are persons who are recovering from a surgery or illness, right? So it may be a broken bone, it may be a surgery where they lost so much blood. So they will need things like vitamin C to help the wound heal faster, protein to build and repair. Say they wouldn't need much carbohydrate at this time because they're stationary. So at this time they're probably having a sedentary lifestyle because they're probably in bed and trying to recover, right? So we speak about nutrients that help to boost the immune system and also those nutrients that will supply the particular need. For example, if it's a broken bone, that this person will want to consume their calcium, vitamin D, and phosphorus as well. All right. Next question, identify 2 types of high intensity activities suitable for adolescents, which may assist them in maintaining optimum health. When we speak of high intensity activity, those activities that they require a lot of energy to perform, all right? And the adolescents, or another name for adolescents, are teenagers, all right? So we may speak of brisk walking, running, swimming, cycling, jumping ropes, dancing, gymnastics, hiking, or playing football. And you may can name a few as well. Now, the minimum length of time for these activities is what, like 60 minutes? All right, a day. Good. Now, let us look at the 2017 paper. And if you haven't noticed, based on these 2 questions that we did so far, both question 1s for 2019 and 2018, they're taken from section 1 of the syllabus, which has to do with diet and health, right? And also likewise for the year 2017 as well. Now let's look at these questions. List 3 types of diets which contributes to good health and well-being of individuals. Next one, recent statistics have shown an increase in obesity in the Caribbean. Say 3 ways in which obesity impacts the Caribbean. Now, this question is similar to the question that asks about diabetes mellitus, right? And why is it costly? So under this question here, we can include how it affects the Caribbean. So we can look at finances as one, right? And list 3 examples of vulnerable groups in the Caribbean. And finally, discuss 2 factors that can threaten the food security of one vulnerable group identified, resulting in undernutrition or starvation of the vulnerable group. All right. Now let us look at the ideal responses. So list 3 types of diets which contributes to good health and well-being. Ideal responses are vegetarian diet, high fiber diet, low fat diet, low salt, and also low sugar diets, right? So you can choose 3 from there. And if it asks you to describe, you should be able to tell what a vegetarian diet consists of, what a high fiber diet consists of, low fat, low salt, and low sugar, all right? And also, the question may ask you, how is it that you can, say for example, limit the amount of sugar in your diet? What can you do? So we try to consume only fruits, and if we're having fruit juices, we don't add additional sugar to them either, all right? And right. So next question. Recent statistics have shown an increase in obesity in the Caribbean. Explain 3 ways in which obesity impacts the Caribbean. So again, we can look at increased government expenditure on health bills, right? Which is very much similar to the question that we did earlier on. So for diseases that are associated with obesity, such as persons may develop hypertension, diabetes, cardiovascular diseases, then the government will have to spend more money to procure inpatient and outpatient supplies. So persons who just visit the government clinic for a checkup, that too they don't pay, so it will cost the government, all right? Increase disposable income spent on health, right? So more money will have to now come out of the pocket, because once someone is obese, their likelihood of developing other complications such as hypertension or cardiovascular diseases, and then it may be 1 or it may be 2 or more, right? So conditions, so they will have to have money to put aside for that as well. Also, human resource capacity is affected. So we have no workers because everyone is getting sick. There's no workers to perform the skill set that a particular organization may need. So if workers are becoming sick, then there will be shortage in workers, and thus workers may have to work overtime at a rate which is higher than their normal wages or salaries, and thus will cost the government More. All right. Next question. List 3 examples of vulnerable groups in the Caribbean. Infants and toddlers, the elderly, pregnant and lactating women, specially abled, and also the poverty stricken, right? Now, these persons are vulnerable because their immune system may be compromised, and also for especially like for the elderly. So as you're getting older, then your body will require more of so essential nutrients, right? The elderly also may have maybe going through some psychological factors. They may lose their loved ones, and thus they have memory loss. They don't remember to eat, and all of these persons here may have to depend on someone to provide food for them. The elderly may not be working, so they don't have as much money to purchase, right? So we speak about access and also availability of food for these persons. Next question. Discuss 2 factors that can threaten the food security of one of the vulnerable groups identified previously, resulting in the undernutrition or starvation of that group. So we just looked at those groups. So let us now look at some factors that threaten food security. So we speak of infectious diseases. So malnutrition and infectious diseases are linked. Poor nutrition leaves children underweight, weakened, and vulnerable to infections. Some common infections are diarrhea, intestinal worms, measles, malaria, AIDS, are factors that cause malnutrition. So because these persons are ill, they will have malabsorption, or they can't keep down anything as it relates to even the diarrhea. So infections can cause malnutrition through its effects on intake of food. So persons aren't able to intake food. We may speak of even the absorption of the food. Even though they're taking in the food it doesn't have any time to absorb because their body is in such a state, right? And utilization of nutrients, and in some cases the body's requirements for them, right? We also speak of age, where we speak of the elderly. So they may have physical or psychological factors. Physical, they're not moving around. They also have financial factors too, because most have retired, stop working. Some of them are not receiving pension, and therefore they have to depend on somebody to eat, right? Psychological factors, dementia, their memory loss, all right, loneliness, just to name a few. Socioeconomic status as well. The high price of food makes life difficult for many low-income customers or consumers, since a lack of purchasing power deprives a person from access to food even though it is available, right? So when we have access to food and it is available, that is very good, right? And we speak of food security too, right? Natural disasters too. We make a Caribbean islands are particularly vulnerable to natural disasters in the form of hurricanes, floods, and droughts, and therefore farmlands are flooded, persons' houses are flooded out, and as a result, there's no food available, no food security. And that is it for our study guide for this episode. I hope it was beneficial. Good luck!